Hi everyone, Dr. Shan here. So if you have recently underwent a knee replacement surgery, this video will serve as a guide in order for you to have a smooth recovery period. So the first topic that I will address in this video is regarding medications. This includes medications that have been prescribed by the doctor as well as medications that you have been taking before. Now typically after the surgery, the doctor will prescribe you with certain painkillers and in certain cases certain antibiotics. It is important for you to complete the medications as instructed and to take the medications at the interval recommended in order to optimize the outcome. Certain patients during this period of time might refuse to take the painkillers, thinking that the pain is bearable, but do take note that the pain is only bearable because you have been receiving painkillers throughout the clock during your admission. Do not be worried about the side effects because the side effects of these medications only happen when you take them for a prolonged period of time, and for the first 2 weeks of this period when you need the medications, you will not be having these side effects. But do advise us in case you have any allergies which can present as simple as itchiness or redness and can be as severe as having swelling and even difficulties on breathing. For the medications that you have been taking before, you may continue them as usual, but if you are taking certain medications such as antiplatelet or anticoagulant, which are typically given for patients with hypertension or heart-related disorders, please avoid the medication for the first 48 to 72 hours as it may lead to bleeding. It's also essential for you to take a medication to control your blood pressure because high blood pressure may also lead to bleeding into the wound. And if you're diabetic, you must make sure that your diabetic is under control with a range of between 6 to 8 because any readings higher than 10 would lead to infection, which is something that we want to avoid. Now the second part of this video, I will address on the wound care. Now typically before you leave the hospital, we would have changed your dressing into something that is sterile and clean. Please make sure that the dressing remains clean and dry at all times, and it should not get wet or get stained. In case it gets wet or gets stained, please reach out to the doctor on what to do next. Typically the wound would heal in a period of 2 weeks and we would check the wound at weekly interval. So you do not need to do dressing daily, you do not need to change your dressing frequently. Alright? Now the next aspect is on how to bathe. So this is a common question that a lot of patients would ask. What is a suitable way of bathing without getting the wound wet? Now I would advise you to be seated on one chair and your leg extended on another chair with something wrapping it, probably a plastic. So in order to make sure that the water does not touch the wound, and once you're done, please make sure that the entire area is cleaned up and dried up so it does not get wet. Now even though the dressings used could be a watertight dressing, but due to the humidity of the weather we sweat a lot and that would cause the watertight properties of this dressing become something that is less over a period of time. So make sure that the knee does not get wet when you're taking a shower, and the best way is to be seated with your knee extended on another chair. Now regarding ambulation and physio, I will simplify this that you only need to be concerned about one physio at this point of time, which is basically range of motion. Now the range of motion that we want to achieve is full knee extension, which means fully straight knee and to bend your knee as much as possible, at least up to 90 degrees. Now this swelling would definitely be something that would make this movement of the knee difficult during the initial phases, but as the swelling becomes less and less, your knee movement will improve. So do take note that you must do the range of motion knee exercise, and it's easier to be done at the bed and or seated on a chair. Keep your knee straight and gradually bend the knee as much as you can. Do this at least 20 times per hour and as many times in a day as you can. Regarding ambulation, please use the walking frame to ambulate. The doctor would have taught you how to use the walking frame before you go back. Please ensure that you understood on how to use the walking frame. Now typically the difficulties that people have is getting up from sitting or from standing to get back seated. Always make sure that the non-operating leg takes the weight of the body. So do not take the weight of the body with your operated leg first. That means the first leg to step is with your operated leg. The last leg to be stepping on when you're getting onto the bed, for example, has to be your non-operated leg. Alright? So avoid stepping on your operated leg. Keep your non-operated leg to be the first to step and the last to step. Now the next is about sleeping. So a lot of patients would be sleeping and trying to find a comfortable position to sleep, and they tend to keep their knee bent or put a pillow under the knee as it causes less pain. But this is something that I would avoid during the recovery period for at least for the first 6 weeks. Avoid putting the pillow under the knee, as this would lead the knee to be kept in a flex position, and when you wake up in the morning and you try to straighten your knee, you will be having pain. So avoid keeping the pillow under the knee. Instead, keep it under the level of your ankle, as this will help you to have a straight knee. Now, surgery is only one part of the recovery period. The post-operative care is equally important, so please remember to follow the guides that have been given here, as this will definitely maximize the outcome of the surgery, and I hope you have a safe and smooth recovery. Thank you.